we're talking about children with disorders in cellular regulation, hematologic or neoplastic disorder, fancy way of saying they've got a blood problem or they've got cancer. These are your learning objectives. We're going to learn about the major hematological disorders and look at comparing childhood and adult cancers and what cancers are most common in children. Priority assessments, lab data, care planning, interventions, teaching, nutrition, psychosocial, and resources available. All right, variations in pediatric anatomy and physiology. Our red blood cell production when we start this life comes from our mamas, it's derived from EPO, epopoietin, which in the liver is where we get it as a fetus, and then after we are born, our kidneys take over. Also, hemoglobin, when we are born, there are three types of hemoglobin: hemoglobin A, hemoglobin F or fetal, and hemoglobin A2. And it's very common to have a fairly high amount of hemoglobin F when we're first born. But by a few months later, we should have mostly hemoglobin A. Then the iron stores, we get iron as a fetus from our mom's placenta. And by the time we're born and grow to be 4 to 6 months of age, that iron is depleted. And so it is important that infants receive enough iron, either in their breast milk from mom, who mom should be taking in sufficient amount of iron to pass that on to her baby, or from iron fortified formulas. Now, preemies, this transfer of iron from the placenta doesn't occur until the later months of pregnancy, the last few weeks. And so a preemie doesn't have that advantage. They don't get those stores of the iron from their moms. So they are already born iron deficient. I love this stuff, and forgive my nerdiness, but this is so cool. Functions of the hematologic system. The erythrocytes, or the red blood cells, that is the function where we get the oxygen. It's for transporting nutrients and oxygens to the body tissue and waste products from the tissues back to often the lungs. The thrombocytes, or platelets, are responsible for clotting. And the leukocytes, or white blood cells, are responsible for fighting infection. And there's various types. There's granulocytes. Granulocytes are neutrophils, eosinophils, and basophils. And agranulocytes are lymphocytes and monocytes. Now, I know that's a lot to process, but just keep in mind there's three systems: red cells, platelets, white cells. And that's real important to understand as we go on into this lecture. I thought this was an interesting chart out of your book. They're comparing childhood cancer with adult cancer. In childhood, cancers usually come from the tissues. Adult, it comes from the organs. In childhood, it's embryonal, leukemia, and lymphoma. Where adult cancer, it's epithelial in origin. Most common sites in children are blood, lymph, brain, bone, kidney, and muscle. Where in adults, it's breast, lung, prostate, bowel, and bladder, though I have unfortunately seen a couple of these in children. Environmental, they don't feel that there's an environmental factor in childhood cancer. A little bit, but not much. They're still trying to figure it out. We do know that environmental and lifestyle factors are huge in adult cancer. Cancer prevention, we don't seem to know how to prevent cancer in children. Things like leukemia, we don't know what they get it from, and therefore we don't know how to stop it. Where we do know that 80% of adult cancer is preventable, either by lifestyle or by early diagnosis. Detection in children, we don't screen children for leukemia, so it's usually incidental or accidental that it's found. Detection. Detection, usually incidental. In adult, we can do very early detection with screening recommendations when they're followed. A latent period, meaning that time of when they get it to when they show symptoms, is real short in children, and it can be up to 20 years. You can be harboring it in your body for a long time. Unfortunately, extensive disease in children, metastasis is often present at diagnosis, where that's not so much the case with adults. But the good thing is response to treatment is very good in children and less responsive in adults. Common medical treatments. I want to just talk a minute about clinical trials. This is how they decide if a medication or a treatment form, whether it be radiation or some other type of thing, is going to work on a long-term basis. And so they do clinical trials. Now, to do this, you have to ethically give the information to the family before a child goes into a clinical trial. But it's how St. Jude, especially, though there are other excellent cancer treatment centers who have had good results with pediatric cancer, but St. Jude is kind of the guru, is that they do these clinical trials. And so over the years, the survival rate of leukemia, for example, ALL specifically, has gone from very poor just 30 or 40 years ago to, I was hearing, of course, it's the St. Jude drive right now, 94% survival rate. So it's amazing, but it has to be done ethically. So here's the ethics. Give consideration to each child's developmental capacity, rationality, and autonomy. Help each child achieve a developmentally appropriate understanding of the illness. Tell the child what he or she can expect regarding the testing procedures and treatments. Assess the child's understanding of the situation and how he or she is responding. Note if there's inappropriate pressure to assent to testing or treatment, and seriously solicit the child's expression of willingness to accept the proposed plan of care. Of course, a lot of this is going to depend on the age of the child, so just be aware of that. But very important that we look at everything. Sometimes the parents are so anxious to treat that we forget that the child should have a say in it too. Please look at 46.1. It's a huge table. I don't want to read all this. I've already included a lot of tables in this lecture anyway, but the big thing to know here is what are the nursing implications for these medical treatments. So I would use, again, the flashcards and put what the treatment is and what the nursing implication is for that treatment, because this will appear on your test. Chemotherapy, your book goes into a pretty good explanation of chemo and what all's involved. Bottom line is it destroys the cell. And unfortunately, when it destroys the cancer cells, it also destroys the normal cells, especially the ones that are that quickly reproduce. And this is a whole list of common adverse reactions to chemo. So you have immunosuppression. Like I said, we destroy the good cells with the bad cells. That also makes the children more prone to infection. Myelosuppression, meaning that everything that comes from the bone marrow, those are the red cells, the platelets, and the white cells, all are suppressed. Unfortunately, the GI system is really hit by this, so they have nausea, vomiting, and constipation, and they get these horrible oral sores, these mouth sores. And the alopecia, that's when they lose their hair, and then there can be pain along with it. Now, when they survive cancer, the long-term effects, especially depending on the age that they get this, is microdontia, meaning that their teeth are smaller or missing. Because the permanent teeth don't develop. They can have hearing and vision changes. They can have blood, immunological, and gonadal, so they can affect their ability to get pregnant. Dysfunction, endocrine, also including growth and precocious or delayed puberty. It can affect it either way depending on the chemo. Various alterations of cardiorespiratory, gastrointestinal, genitourinary system. Development of secondary cancer as an adult or even as an adolescent. So, they survive, but there sometimes are complications from that survival, but it's still worth it in the long run. Radiation, that's when they shoot x-rays, if you will, at the area. It can be curative, or it could just be along with another treatment, or palliative, just keeping them comfortable. So there's several ways radiation therapy is used. Adverse effects of it: fatigue, nausea, vomiting, oral mucositis. Looks familiar, doesn't it? Myelosuppression and alteration in skin integrity, especially at the site of irradiation. So you have to keep that in mind. And as a nursing implication, when they get back from radiation, if they're inpatient, so you need to check the site of radiation and watch it closely. Again, long-term complications from the area that's radiated: alterations in growth, again, hormone dysfunction, hearing and vision, learning problems, cardiac dysfunction, pulmonary fibrosis, hepatic, sexual, or renal dysfunction, osteoporosis, and possibly development of a secondary cancer, particularly at the site of irradiation. So again, none of it is without its problems, but it's the alternative is not right. Briefly, I'm going to talk about stem cell transplantation. Here you've got to get a good health history, good physical exam, the whole thing: inspection, observation, listen, percuss and palpate. Psychosocial assessment. Here's the problem with any kind of transplantation, but especially stem cell transplantation, is these children are in isolation for a little while after the transplantation, and sometimes even before, because they are irradiating their whole body to get rid of as many bad cells as possible, and then they give them the good cells back in there. And so there's a massive amount of laboratory diagnostic testing. I am not here to make you a hemonc nurse today. I'm here to help you at least understand when you hear the term that, oh my. Now, if you choose to go into it, it's a very specialized field. Now, I put these on slides because you're going to hear this terminology a lot, and I want you to be familiar with these tests. Alpha-fetoprotein test. Alpha-fetoprotein is produced by fetal liver and yolk sac and normally decreases to very low levels by 1 year of age. Why you do this is in Hodgkin's disease, and we had a little girl that had, of all things, a little girl with ovarian cancer, and the AFP was elevated with her. And so they take this AFP, and for her it was elevated. So when we started the treatment for her, you can see how well the tumor is decreasing by checking AFP levels and seeing if it's coming down with the treatments. No food or fluid restrictions required. It's just a simple blood test. Type and cross match for blood. A lot of these kids, remember I said, chemotherapy and even radiation therapy affect the bone marrow, and so they're not getting the red cells they need, and so oftentimes they will need a transfusion. So they're going to get the type and cross match, getting their ABO type as well as the antigens. Cross match is performed on RBC containing products to avoid transfusion reaction. Trauma victims or any person with whom blood loss is suspected is who we do this on. Nursing implications: avoid hemolysis. That means it needs to get to the lab right away. You need to rotate it if you're there when it's being drawn. Be sure and sign and date it appropriately, and apply the type and cross match or blood band to the child at the time of the blood draw if indicated by the institution. And I don't know what institution this doesn't do this. So, and usually that's done by the lab who's drawing the blood. Bone marrow aspiration. This is a can be very painful procedure. A needle's inserted through the cortex of the bone into the bone marrow, most often at the iliac spine. Bone marrow is aspirated and the cells are evaluated. In other words, it's done in the hip area. Evaluation for leukemia or metastasis of other cancers to the bone marrow. Big thing is we send the parent home with EMLA cream. We've talked about EMLA cream before. It needs to be on for a considerable period of time. That's why we'd have the parents, we should mark the spot for the parents to put the EMLA on, so that by the time the child comes in for their biopsy, it's nice and numb. We can use lidocaine, but then you're using, unless you're using LAT, the topical, if you're using the needle lidocaine, then you're causing more trauma by using a needle. We often use conscious sedation. In the old days, it was Versed and fentanyl. They're probably using other things now. So the child is very groggy. We hook them up to an oximeter and pulse oximeter and EKG and watch their vital signs during the procedure. Apply once the procedure's done, and it's very when you watch it done, the doctor pushes in very hard and kind of screws it down to get it in through that thick bone and get the marrow out. So when that's all done, your job is to apply pressure dressing to stop the bleeding, watch for tenderness and erythema, and they might need mild analgesic afterwards because it does hurt. Bone scan, they put IV material, IV radionuclide material taken up by the bone, and so you can see it on the scan, and this is to identify some of the different metastases to the bone, which we'll talk a little bit more later about. It does require an IV. We encourage lots of fluid to increase the uptake, and the scan will be performed 1 to 3 hours after the injection. So it's kind of a long process. You know what a chest x-ray is. Indications is looking for tumors in the chest, looking for pneumonia, any other things that could be going on with that child. And the implication here, the chest must be held stationary for a very brief period of time. Clotting studies, we see this more in dealing with the hematology portion, children that might have hemophilia or von Willebrand's. So that would be more common in that particular area. Prothrombin time, partial thromboplastin time, activated partial thromboplastin time, and international normalized ratio. PT, PTT, APTT, and INR is what you'll usually hear them called. Evaluation in common pathway, it's a blood stick. It's an arm stick that they have to, lab comes up and does. Not any prereqs that have to be done with this. Apply pressure to the venipuncture site afterwards and assess for bleeding and gums, bruising, blood in the urine or stool. Now, this is not because of the study being done, but because of the reason for the studies. The child is evidently having some bleeding issues, and so we need to watch. Coagulating factor concentration measures concentration of specific coagulating factors in the blood. Indications are for hemophilia and DIC, which we will talk about a little bit later. Apply pressure to the venipuncture site. Assess for bleeding gums. Again, the same thing's going on. You're not doing that because of the test. You're doing that because of the cause of why they're having the test done. And deliver the specimen to the lab. It's unstable at room temperature, so it needs to get put on ice if you can't get immediately to the lab. CBC, y'all should have heard of this one. CBC with differential complete blood count evaluates hemoglobin and hematocrit, your white blood cell count, and your platelet count. This, you can learn so much from a CBC. This is why a CBC is such a common test done. Its indications are for anemia, infection, bleeding disorders, clotting disorders, immunosuppression. It determines if they've got neutropenia and myelosuppression. Nursing implications, you need to realize what the normal values are. And in the book, it has it by age and gender in a table. WBC differential is helpful in evaluating the source of infection, may be affected by certain medications. Great test. Really learn your CBC. A CT scan, computed tomography, is multiple films taken in successive layers to provide a 3D view. This is to help us to identify tumors. Nursing implications, sometimes it's done with oral or IV contrast, but if the child has a iodine or shellfish allergy, the physician needs to be notified because there's going to need to be a change in how it's done. And they may need several hours of MPO if contrast is used, because the contrast can cause nausea. Encourage fluid intake after the scan to facilitate excretion of the contrast dye. Hemoglobin electrophoresis, remember I talked about hemoglobin A and hemoglobin F. This helps find those. There's also one called hemoglobin S, as in Sam, as in sickle cell. And hemoglobin electrophoresis is often done to test for sickle cell anemia. It's also done to test for thalassemia, which we'll talk about both of those in a little bit. Measures the percentage of normal and abnormal hemoglobin. Blood transfusions within the previous 12 weeks can alter the test results because you may be picking up the donor's hemoglobin. So it's important to not note that if you're having a hemoglobin electrophoresis done on a child. Iron levels, evaluates iron metabolism. We do this for iron deficiency anemia. Hemosiderosis with chronic transfusion or hemoglobinopathies. Hemosiderosis is a accumulation of too much iron from so many blood transfusions. Nursing implications, recent blood transfusions will increase the level of iron. Child should fast for 12 hours before the test and avoid, again, that clotting, the hemolysis, because it will falsely elevate the results. So again, rotating that tube back and forth so it doesn't clot. Lead level, measures level of lead in the blood. We do this when we're concerned that a child might have lead poisoning. And the normal amount of lead in the blood should be none. There should not be lead in the blood. Lumbar puncture, a needle is placed in the subarachnoid place of the spinal column. You curl the child on their side into a little C. So their spinal column is a C. Below the base of the cord, cerebral spinal fluid is withdrawn for analysis. And we're looking here for a tumor or metastasis to the brain or spinal cord. We see this, unfortunately, in leukemia. We see it sometimes go to the spinal fluid. Also used to administer intrathecal medications. Again, we see this done with specifically leukemia. Again, using EMLA, just like we did for the bone marrow biopsy. Use EMLA before the procedure to decrease pain. Again, we tell the parents where to mark it, and then they bring them back in and have this done. Conscious sedation helps a lot. Position the child appropriately. Distraction techniques, we let kids bring in their own earbuds with their own music that they can listen to while we're doing this. And then they need to recline for up to 12 hours after the lumbar puncture. If they sit up too much, they'll get a massive headache because of the decreased spinal fluid in the spinal column. MRI, magnetic resonance imaging, based on low hydrogen atoms behave in a magnetic field. Identify extent of tumor or metastatic spread. For an MRI, remove all metal objects from the child. They have to be still for the entire scan. Parent can stay in the room with the child. Definitely a younger child may need sedation. Even some of your older child. There's a loud thumping noise inside that can really be scary to kids when they're having the MRI done. So lots of prep. A reticulocyte count is simply a blood test. They often do this with a CBC. It measures the amount of reticulocytes. Reticulocytes are little immature red blood cells. This tells us that the body is producing them. It indicates the bone marrow's ability to respond to anemia with production of RBCs. And when we get children taking their iron supplementation in an iron deficient child, we actually see the retic count increase. So it's very good. Serum ferritin. Ferritin, again, is a form of iron. Measures the level of ferritin, the major iron storage protein in the blood. So we're going to, of course, do this test to check for iron deficiency anemia. It's elevated in hemolytic. Hemolytic means that the red blood cells are being destroyed. And if transfused recently, iron supplementation increases the ferritin levels. Almost done with the tests. Urine catecholamines. Its catabolism of the catecholamines causes elevated levels in the urine. This is a specific test for neuroblastoma. Neuroblastoma actually produces catecholamines. So when you've got an elevated catecholamine level in the urine, that tells us that they may have neuroblastoma. It's a 24-hour urine collection. Certain foods and drugs and vigorous exercise can actually skew the results. So important to do good pre-education on. And the last test we're going to talk about is ultrasound. High-frequency sound waves are directed to internal organs. Indications to find tumor presence, especially in the abdomen or the kidney. They need to be fasting a few hours before the test. So